HealthLink is proudly brought to you by Moods Condom and Home Fresh.
Hello viewers, welcome to HealthLink TV show. I'm Stella. HealthLink TV show is health awareness weekly television program with its focus on sustainable development goal 3. Today on the show, we are discussing uterine fibroid, commonly known as fibroid. According to National Institute of Health, about 80% of women get fibroid at the age of 50. However, most of them are not aware of the symptoms and they may never know they have uterine fibroid.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Hey. Flowers on the bed. Hey. Plain Cujo Inchi. Wow. Honestly, I was still too tired. But then he pulled it out. Moods condoms. Oh. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms. This comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms. Lay it right. Marketed and distributed by Pharma Nova Limited.
Uterine fibroids are tumors that grow in women's womb and the growth are typically not cancerous. Many women have uterine fibroids sometime during their lives, but most women don't know they have uterine fibroids because they often cause no symptoms. A doctor may discover fibroids incidentally during a pelvic exam or prenatal ultrasound. Stay tuned as we learn about uterine fibroids, how it varies, the multiple types of uterine fibroids, among all other important issues relating to uterine fibroids.
Welcome back. With me is Dr. Samuel Etia, a resident studying obs and gynae at 37 Military Hospital. He is here to educate us more on uterine fibroid. Doctor, you are welcome.
Thank you very much.
How are your patients?
They are all doing well.
Alright, that's great. According to our research, about 80% of women get fibroid at the age of 50. So who is at risk of getting fibroid? Because the population is quite huge. 80% of the total population of women can get fibroid.
Okay, so talking about uterine fibroids and its risk factors, all women in their reproductive ages are at increased risks of developing uterine fibroids, but more particularly the ages between 35 to 40 years. Okay. Also, women who are of the black race are at increased risks of developing uterine fibroids. And then if you have a positive family history, let's say your mother or your sister has uterine fibroids, then you are also at increased risks of developing uterine fibroids. Someone who hasn't given birth before, that is nulliparity, she is also at increased risks of developing uterine fibroids. And then obesity, that's people who are usually huge or big, they are also at increased risks of developing uterine fibroids.
So how does someone who hasn't given birth before get uterine fibroid? Because the womb is not, it's empty, it hasn't conceived before. So how does it happen?
It's said that the uterus abhors emptiness.
Okay.
It was created for a baby to grow inside. So whenever it's empty, something grows inside. Not always, but that's what it said. But more importantly, the fibroid grows under the influence of a hormone called estrogen. For those who give birth, during the postpartum after delivery, that period, they breastfeed. And when they are breastfeeding, the estrogen hormone is suppressed. Okay. And that's the particular hormone that feeds fibroids to grow big. So for those who give birth during that period, there's suppression of that hormone. And therefore, for them, they are at a lower risk of developing the fibroids. But for someone who hasn't given birth before, your levels of estrogen just keeps building up periodically as and when you are ovulating.
You mentioned that someone who is obese is at risk of getting fibroid. So I've seen a lot of slim people having fibroid. How does obesity cause fibroid?
So for those who are obese, they have a lot of body fats, and the fats in their peripheries, that's the extremities, is responsible for converting a hormone called testosterone to estrogen. Okay. So they have higher levels of estrogen in their body. And as I said earlier on, estrogen is the main hormone that feeds a fibroid to grow. So that's the main reason why they are at increased risk of developing uterine fibroids.
So the slim people, what causes fibroid?
So for the slim people, it may be due to some of the other risk factors we have talked about. You don't need to have all these risk factors to develop uterine fibroids. Okay. So probably maybe in their family they have that positive family history, or probably they haven't given birth before. So any of these risk factors may predispose someone to developing uterine fibroids.
Right. How will I know that I have uterine fibroid?
Okay, uterine fibroids may present in two ways. Okay. You may not show any symptom at all, what we call asymptomatic. So you can have uterine fibroids, and yes, though you don't know until maybe one day you go for a checkup, and then the doctor incidentally notices that you have a uterine fibroid. Right. But for those who present with symptoms, some of the main symptoms are menstrual irregularities. So most of the time they will be experiencing heavy menstrual flow, or the menses will be prolonged for more than the normal days that they experience, or they may even experience intermenstrual bleed. That is, their menses stops for some time and then it recurs, even though it's not time for them to have their menstruation. Most of the time too, fibroids may present with severe low abdominal pain when they are degenerating. So most people will come up complaining of low abdominal pains, and will be thinking about uterine fibroids as one of the diagnosis. Also, uterine fibroids may be associated with infertility. I'll describe that later as we go on.
I mostly hear people complaining that there's something moving in their abdomen. Can it be fibroid?
Yes, it's possible. Most of the time, that's one of the complaints that they come up with. But it's actually when the fibroids grow bigger and bigger, they grow into the abdomen. And sometimes for those who are a little bit cautious about their body, they examine themselves and then they notice this mass in their body, a mass that feels firm and then has a very rough surface or nodular surface. So for them, they will come up complaining with movement of a mass in their abdomen, and that's what we usually see in the hospital.
Doctor, a friend of mine complained of bloated stomach. She went to the hospital and she was diagnosed as having fibroid. Does that mean that everyone with big stomach is having fibroid?
Not at all. Having a big stomach is not equal to uterine fibroids.
Okay.
You may just be having accumulated abdominal fat.
Okay.
So for those who are obese, they may have increased abdominal fat, and it's not uterine fibroids. Maybe that's how the person is. Okay. But sometimes it may be due to uterine fibroids when it is growing quite huge. Okay.
Do we have types of fibroid?
Yes, we have different types of fibroids, and the types depend on the location of the fibroid in the uterus or the womb. Okay. So for when you take the uterus, there are three main layers. You can talk about the inner layer, the middle layer, and then the outer layer. So depending on where the fibroid grows, then we name it according to that location. So we can talk about intramural fibroids. That is, it is found in the muscle itself, in the myometrium of the uterus. And then we can also talk about a fibroid that is growing outward of the uterus. For them, we call it subserosal uterine fibroids. And then when they grow inwards towards the uterine cavity or the endometrial cavity, we call them submucosal uterine fibroids. And all of them present differently.
So which one causes the stomach to be big or the abdomen to be big?
Good. So if you have a huge intramural uterine fibroid, that's one located in the muscle itself of the uterus, and it is growing that big. Can even grow to the size of a normal baby at 9 months.
Wow.
So then you notice the abdomen becoming big. If you also have this subserosal one, which is growing out of the uterus, it can also present as a huge abdominal distension that you have to pay particular attention to.
And does it cause pain?
Yes, fibroids may cause pain. That's one of the main presentations. Most of the time they undergo a process called degeneration. and when they are degenerating, it is very painful. And it is mostly experienced during pregnancy.
Doctor, how dangerous is fibroid on the health of a woman?
Okay, so for those who have been experiencing heavy menstrual flow, what we call menorrhagia or prolonged menstrual bleed, then they will end up having anemia. That's a low blood level. And having anemia has several complications on the heart, on the kidneys, and other body systems as well. Okay, and also when the fibroid grows huge, it may put pressure on the structures surrounding it. So an example of these structures is the bladder and then the ureters, which are supposed to help in excretion of urine. So at the end, it can even lead to renal failure if care is not taken. And then people with uterine fibroids, depending on the location, particularly those with the submucous, the ones growing toward the endometrium or the uterine cavity, they mostly present with infertility.
And can it affect pregnancy?
Yes. Those that grow toward the endometrial cavity usually distort the endometrial cavity. And therefore, when a sperm fertilizes an egg, the embryo that forms is supposed to implant in the endometrial cavity. But because of this fibroid there distorting the endometrial cavity, it fails to implant. The fibroid, depending on the location too, may block the tubes and therefore prevent sperm travel towards the egg, which has been released through the tubes, and therefore it will prevent fertilization at all. So these are some of the ways that uterine fibroids may be associated with infertility.
Can it also affect childbirth?
For childbirth, yes, if a patient has uterine fibroids, it may affect childbirth. First of all, to the woman who is pregnant, she is at increased risk of the rare degeneration, a situation where she would be experiencing recurrent abdominal pain because of the fibroids. And then also, women with uterine fibroids are more prone to preterm delivery. So their time will not be up, but then they will go into labor and then deliver. Also, the placenta sometimes implants at a wrong place because of the uterine fibroid occupying the normal place the placenta is supposed to implant at. So it can cause wrong implantation of the placenta. And then when it comes to labor, then particular attention should be paid to where the uterine fibroid is located. Because if the uterine fibroid is located at the lower segment of the uterus, that is where the baby's head will pass before coming out, then it means it will obstruct the labor at a point in time. Okay. So for those people, the doctors examine and they are sure of where the fibroid is located, and then they decide on the mode of delivery, whether they will allow you to deliver vaginally or by a cesarean section. And then to the baby that's inside, having uterine fibroids may cause abnormal separation of the placenta. An obstetric emergency we called placenta abruption. Okay. So the woman will present with vaginal bleeding in pregnancy. Also, the fibroids may prevent the baby from developing into its full potential. So most of these babies will come with intrauterine growth restriction. So they do not grow very well as compared to other babies.
This is HealthLink TV show. Keep watching. We'll be right back.
So, when he opened the door, I stepped into the room and I couldn't believe my eyes. Candles everywhere. Flowers on the bed. Plain Cocho entry. Honestly, I was still too tired. But then he pulled it out. Moods condoms. And I told him, you should have led with that.
A real man puts her pleasure first. Moods Condoms. This comes in over 19 exciting variants to keep you and her in the mood. Moods Condoms. Layered right. Marketed and distributed by Pharma Nova Limited.
Welcome back. We've been discussing uterine fibroid. Doctor, can I assess myself at home to know whether I have fibroid?
Yes, you can assess yourself So as I said, if the fibroid is growing very huge, then you may be able to palpate it in your abdomen as a mass that looks...
Palpate like how?
When you touch, when you say palpate, it means touching it in your abdomen. So when you press your abdomen gently, you may feel a mass in the abdomen. Normally, you are not supposed to feel anything in your abdomen when you press your abdomen. So you feel this firm mass, which has a very rough surface. But to be honest with you, you should report to the hospital if you suspect anything like that, and not sit at home and just be palpating your abdomen when you're experiencing the symptoms we've talked about, like the heavy menstrual flow and then the lower abdominal pain.
When I come to the health facilities, what are the procedures that I'll go through before you arrive at your diagnosis that I have uterine fibroid?
So when you report to the hospital, the doctor will take time to have a discussion with you. Not all those symptoms is equal to uterine fibroids. You may be having heavy menstrual bleeding, but it's not necessarily due to uterine fibroids. So based on the subsequent questions the doctor will discuss with you or will ask from you, the answers will direct to whether you have uterine fibroids or not. After the history taken, the doctor will also take time to examine your abdomen, and that's when most of the time we confirm that you have uterine fibroids. And then the doctor will move on to perform a vaginal examination, what we call bimanual examination. So they will look through the vagina to see if there are any other lesions, especially on the cervix, because other causes of bleeding from the vagina, it could be cervical cancer as well. So we have to rule that one out, and then we do that examination also to estimate the size of the uterine fibroids. So after the examination and the history, if the doctor arrives at a diagnosis of uterine fibroids, he goes ahead to perform other investigations. So most of the time, a pelvic ultrasound scan is enough to diagnose uterine fibroid. Okay. Aside the scan that the doctor will request, he may request other basic labs like a full blood count.
Okay.
The full blood count helps us to know your blood level, the hemoglobin level. So for instance, someone who has been bleeding heavily would want to know where the blood level is, so that if there is a need to correct it, we do so. Aside the full blood count, another test that is performed is the kidney function test. As I described earlier on, a huge fibroid may put pressure on the ureters, and that may lead to accumulation of fluid in the ureters as well as the kidneys. A condition we call hydroureters or hydronephrosis, which can subsequently lead to renal failure. So we have to perform investigation to find out if all these systems are normal.
I've been hearing this, that unimedra ebenane, meaning like your fibroid will melt on taking certain medication. Is that true?
Well, I've also heard about that a lot, but I'm yet to see someone who has really confirmed it with a scan. Say he has been diagnosed with uterine fibroids, and after taking a medication, he goes back to take another scan and it's no more there. Wow. But one thing you should know about the behavior of uterine fibroids is that it may undergo certain changes, and one of these changes is called atrophy, what you describe as melting.
Okay.
When the blood supply to the uterine fibroid is cut off, then there will be no more estrogen supply to the fibroid. And as we described earlier on, estrogen is the main hormone that feeds the fibroid to grow. So therefore, when you have the blood supply cut off, this fibroid has no estrogen supply, and therefore will start undergoing a process called atrophy. It will shrink to a smaller size. So probably that's what they describe as melting. I don't know any medication that does that, any herbal medication that does that, but there are orthodox medications that can be used to shrink uterine fibroids. So for instance, if you have a huge uterine fibroid and you are planning to have a surgery for you, we don't want you to bleed too much when you are having this surgery. So therefore, we'll give you some medications to shrink the size of the uterine fibroids so that the surgery becomes a simple one. So we have medications like that can shrink the size. But the important thing about those medications is whenever you stop it, the fibroids will grow to their normal size again.
Viewers, as the doctor said, it doesn't melt, it shrinks. Doctor, what is the treatment of fibroid?
So when it comes to managing uterine fibroids, several things are considered.
Okay.
Is the patient presenting with symptoms or not? What symptoms is the patient presenting with? Whether it's heavy menstrual bleeding or just abdominal pain, or it's associated with infertility, or it's disfiguring the abdomen so that the patient cannot even wear the shirt or the top that she wants to put on.
Okay.
And then we also consider the patient's age. She a young woman in her reproductive age, or someone who has finished giving birth, finished having a family. We also look at the desire to give birth or fertility wishes. So that will decide on what we'll do for the patient. Okay, whether we just have to remove the fibroid or we have to remove the whole uterus, which is also another surgical way of operating on uterine fibroids.
So doctor, it means that it's not every fibroid that needs surgical intervention.
Yes, not all fibroids need surgical intervention. We consider several factors that I've described earlier on. Your desire to have a baby, your age, and particularly the symptoms you are presenting with. So we can use medications to control some of these symptoms. So for example, if you are presenting with heavy menstrual bleeding leading to anemia, we put you on some medications to stop the bleeding or to reduce the flow. Or we can even stop your menses from happening totally for some time until we correct your anemia to a normal level. Okay. When it comes to the pains too, we can give you some pain relief to control the pains. And then when it comes to infertility, for that one, you have to investigate for other causes of infertility. Because fibroid, as I said, may cause infertility, but most of the time there are other causes. So you have to look at your husband, you have to look at you yourself, your tubes, whether they are blocked or they are patent, and then some hormones that are in control of becoming conceiving. You have to look at all of them. Before, if we don't find any cause, then we say that it's due to the uterine fibroids. And for that one, surgery is needed for the fibroids to be removed.
And what is the success rate of conceiving after going through the surgery?
So most books have reported about 50% success rate. That's after having fibroid removal. But most of the time they do get pregnant after they've had their fibroid removed. That is if the fibroid was the main cause of the infertility. But as I said earlier on, if there's another cause of the infertility, then you may remove the fibroids and yet still you will not be able to conceive.
Doctor, there's a perception that if you remove fibroid, you need to get pregnant within some short time. How true is this?
Yeah, fibroids can regrow, what we call recurrence. And because of this, before a doctor performs a surgery to remove fibroids, he would want to find out from you whether you are ready to get pregnant or not. Because imagine you remove fibroids, that is not causing any other problem. It's not causing excessive bleeding, it's not causing pain, but you just want it removed for the sake of it. And yes, so you are not ready to get pregnant. These fibroids may regrow, and after some years, maybe 5 or 6 years, you may experience them again. It doesn't happen in everyone, but there is a few percentage who have recurrence of fibroids, and you may need to come for the surgery again. So it's better for us to know if it's not causing any symptoms, then it's better for it to be performed close to when you are about planning to conceive. Okay, so maybe some 6 months to when you are planning to conceive, you can plan and have it removed, so that after the healing process, about 3 months, then you are ready to go, you can conceive.
Are there home remedies for the treatment of fibroids?
Not that I know of. I haven't actually come across any home remedies that can treat uterine fibroids.
And what is the complication if a patient refuses surgical intervention?
So I think we've talked about most of those complications. A fibroid that presents with excessive menstrual bleeding will lead to anemia, and anemia in turn can lead to heart failure. So that's one major complication. And the huge ones to that press on the surrounding structures may cause hydrouretus and then hydronephrosis. That is just the ureters enlarging, as well as the kidneys becomes bigger because of accumulation of the urine in it, and that can lead to renal failure or kidney failure.
Doctor, I want you to educate us more on the surgical intervention of fibroid.
Okay, so for those who are refractory to medications, that is, the medications are not able to control their symptoms of heavy bleeding or severe low abdominal pain, then surgery is indicated. And when it comes to the surgery, as I said, it depends on your age and whether you've completed your family or not. So for someone who has the desire to give birth, we go in for myomectomy. That is removal of the uterine fibroid alone, and we leave your uterus intact. For someone who has completed a family, has no desire to give birth, and probably has gone past the reproductive ages above 45, probably menopausal, then we look at removing all of the uterus. So those are two surgical interventions that we usually do for uterine fibroids.
So can fibroid be prevented in any way?
So if you look at the risk factors of uterine fibroids, you realize most of them cannot be modified. That is, if you look at your family history, there's nothing you can do about it. In the black race, and then being a woman in the reproductive age, there's not much you can do about it. But obesity is one thing that all ladies can work on. You can work on reducing your weight through exercise and then a healthy diet, and that will reduce the risk of uterine fibroids associated with obesity. And also, when it comes to nulliparity, they are also at an increased risk of developing uterine fibroids. So if you haven't given birth before, probably you want to think about having a family.
Doctor, I saying that we should all go and give birth to prevent uterine fibroids?
No, not at all.
Okay. Doctor, so can fibroid eventually turn into cancer?
Well, there is a small chance that a fibroid may develop into a cancer, and it's just 0.5%. So I think like 1 in 200 people. So it's very rare. It doesn't usually turn into cancer, but it may happen.
And what's your last word for those watching us at home?
Okay, so to the viewers out there, if you're experiencing any of these symptoms that we've talked about, or you have any of these risk factors, then you should report to your physician as soon as possible. It will take time to examine you, then after diagnosing it, together with your other complaints, will give you the best form of treatment that you need. Don't keep it to yourself and be taking herbal medications at home, because they may have other complications that you are unaware of.
Doctor, thank you so much for joining us on HealthLink TV show.
You are most welcome.
We are grateful to have you here. I hope to see you next time.
Yeah, hopefully.
All right. To you viewers, thank you so much for watching this show, and special thanks to Crown Medical Center for supporting this show. See you same time next week. Until then, always remember that your health is your priority.
HealthLink was brought to you by Moods Condom and Home Fresh.